As war rages, health services for women are perilous and they are particularly vulnerable to trafficking, domestic abuse, and gender-based and sexual violence. Women in particular are experiencing negative effects on their mental, physical, sexual, and reproductive health as Russia's brutal war in Ukraine continues to wreak lives throughout the nation. There are still millions of displaced women, which leaves them incredibly open to sexual and gender-based abuse as well as human trafficking. Last month, the International Rescue Committee issued a warning about the rise in violence against women. While hospitals are being attacked, some expectant mothers give birth without medical help in basements and bomb shelters, and many people's reproductive health is in danger as a result of the widespread disruption of essential services. In Ukraine, nearly 180,000 women gave birth in 2022, with many facing a danger to their lives due to barriers to proper health care. Shelling has been directed at civilian facilities, including hospitals. It is inappropriate for a pregnant lady to be stumbling around while accessing facilities. The management of birth and pregnancy complications as well as the supply chain for medical supplies required for C-sections are also affected. Healthcare professionals have occasionally been made to reside in the hospitals where they work, which adds a lot of stress. Preterm births and losses are on the rise, along with diseases like eclampsia and hypertension. Women's nutrition is also being harmed by their bodily exhaustion and months of displacement. The birth and the following 72 hours are the most crucial period in a pregnancy. Any woman who doesn't follow up with a specialist during that period may experience complications that could be fatal. 84 women gave birth in the Kyiv metro during the first week of the main conflict. Women who give birth while seeking refuge from missile strikes underground, such as in subway stations or basements, run the risk of developing potentially fatal conditions like sepsis, which endangers both the mother and the unborn child. Any assault on a hospital or other piece of civilian infrastructure is wrong and should never happen. These assaults jeopardize civilians' ability to obtain life-saving services. Many women are apprehensive about visiting clinics while they are shelling. To try can be incredibly dangerous. A number of women who went to hospitals in Chernihiv, to the north of Kyiv, at the start of the conflict to give birth discovered they couldn't return home because Russia had taken over their villages. One lady left her other children with their grandparents and went to the hospital with her husband to give birth. She was unable to see or communicate with her children for a month due to Russia occupying her house. You can probably understand the degree of stress and anxiety that causes. Since the start of the conflict, there has been an increase in interpersonal violence as well as violence against women and girls. Millions of people were moved by the invasion, many of them women and children. The likelihood of gender-based violence, sexual violence, human trafficking, and other forms of exploitation increases when there are so many people at that degree of vulnerability. Our top priority was to rapidly reopen services like shelters and mobile clinics and to let women know they could get hygiene kits and psychosocial support to maintain their dignity. After Bacha and Irpin's freedom, we first noticed instances of sexual assault. None of the survivors had alerted the authorities to the instances, and the majority needed assistance in getting tested for pregnancy or STIs, sexually transmitted infections. This is a complicated problem that is shrouded in shame. Women occasionally fail to report themselves as having been attacked. For example, some women have been made to perform sex activities in order to pass a checkpoint. Psychologists must put in a lot of effort to help these people open up and recognize that they are victors, and it will take time for the trauma to subside. We created a project before the conflict that gives Ukrainian military men a place to interact meaningfully with their wives and kids. Beginning in 2014, the first centers were in the East. In order to steer males away from toxic masculinity, we offer them psychosocial assistance. This aids in their recovery from trauma, which can appear as abuse, violence, or alcoholism. Numbers are difficult to depend on because they don't accurately reflect the issue. Due to trauma, stigma, and self-blame, many survivors are hesitant to share what occurred. Two-thirds of the cases listed by the UN High Commissioner for Human Rights, OCHA, involve women, and one-third involve males, many of whom were once prisoners of war. The amount of cases that have been reported is likely only the very beginning. The staff at our Dnipro center informed me that out of every 100 women they have encountered, perhaps 10 have experienced gender-based violence and 1 has experienced sexual violence. People occasionally make an effort to deny what happened or to cope with it while avoiding seeking assistance. Survivors must be made aware that they are not in this position alone, that it is important, and that the UN and the Ukrainian government are working to give them the best care possible. Over 17,000 women have received general assistance from our mobile teams and nearly 10,000 from our relief centers so far. The more resources we provide, the more survivors will ask for assistance. We are now very concerned about how long this situation will last. Women from the east and south have moved in large numbers to the west and center of Ukraine as well as overseas. The challenging circumstances of displacement make women's requirements more complex. The well-being of women and their families is severely hampered by the lack of accessible employment and income, as well as the difficulty in some areas in getting access to health care. We are continually attempting to keep up with new developments, and what we are seeing is that the situation will be worse in 2023. We have asked to enter occupied territory on numerous occasions, but we have not been given access. Concerns about the plight of elderly women are particularly acute in the east of the nation. Some people have severe medical conditions, like uterine prolapse, and are living close to the front lines of the conflict because they don't want to leave their homes. There are some government-run mobile clinics that we fund that travel to communities to assist, particularly for people with disabilities or mobility issues and for places without public transportation. War causes suffering, discomfort, worry, and anxiety. Millions of women's suffering is being prolonged by the continuation of this conflict.